Welcome back. A new centre in Singapore is gearing up for the next pandemic by making sure the next generation of public health leaders in the region know how to react to future crises. Launched by NUS Medicine, the Centre for Infectious Disease Emergency Response, or CIDER, will offer a new Masters of Science programme in infectious disease emergencies. The qualification is described by the school as the first of its kind. The course will start in July and see an initial cohort of up to 80. It will be tailored for early to mid-career professionals with work experience in sectors like public health. Students will learn practical skills needed to lead during infectious disease crises, and these include how to communicate to the public effectively and support mental health needs during a pandemic. Now, the centre will also focus on expanding the region's capacity to respond to such emergencies with a long-term vision to foster global health equity.
When the next pandemic comes again, it will be a global threat, requiring a global response, with countries working closer together. So the recent decision by the US and Argentina to pull out of the WHO is a major setback in this global effort. But we need every country to be part of a future pandemic response, and especially the US.
Separately, Mr. Ong also says Singapore is setting up a healthcare reserve force, which will be manned by around 1,000 volunteers. They will support non-clinical operational roles such as testing and case management operations during health emergencies. Now, for more on what the centre plans to do, I'm joined by Centre Director Professor Dale Fisher. Professor Fisher, welcome to the show.
Thanks, Shahida.
First of all, how is this centre different from what Singapore already has to prepare for infectious disease outbreaks?
I'd like to just start by talking about the global picture, and really the world did not do well during COVID. There were 18 million excess deaths between 2020 and 2021. So these are people that either died of COVID or died because the usual healthcare system couldn't look after them because the hospitals were paralysed by COVID. We saw for the first time in 20 years the poverty levels in the world actually increased. Average time with school closures in countries was about 4 months in 2022. The governments lost about $11 trillion during those 2 years. And just imagine if that money could be spent on schools and hospitals and things now, but that money was just lost because of the way the world responded. So what we hope is that we can change the narrative a little bit, that while people, of course, want to forget, they've got other bigger pressing problems now, cost of living, inflation, things like that, people want to forget and move on. They don't want to remember those painful couple of years, but that's not a way to protect ourselves for when this happens again. So this, both the book and the master's course that we're creating, and other short courses that will probably spin off from that, can help Singapore, different aspects of Singapore, but also can really help the region and even globally if governments or institutions are keen to use us.
So this basically came about from the lessons that we learned from COVID-19. And are we also looking at infectious disease emergencies to be occurring more regularly now?
Well, I think that's pretty evident. Since SARS, there was H1N1, which actually turned out to be not so severe, so that was good, but it was certainly a novel virus. We've seen MERS emerge in the Middle East, and of course, when that went to Seoul, South Korea, and that caused devastating problems there. We've got COVID. This has all happened in the last 20 years. So do we really think nothing's going to happen in the next 5 or 10 years? The answer is no. And furthermore, what's it going to look like? As Minister Ong said at our launch today, we don't know what it's going to look like. Every time we plan for something, it looks slightly different. So we've got to be nimble enough to be able to adapt our responses.
And CIDER will offer a new Masters of Science program in infectious disease emergencies. The qualification is said to be the first of its kind. What are some of the skills that you think are still lacking in Singapore and the rest of the world? Where are the gaps, basically?
Yeah, so the gaps vary by country, and I think, without patting our country on the back too much, Singapore did very well. There's obviously some gaps, and there are gaps that are emerging or continuing to become more complex. Misinformation, for instance, is a problem everywhere, and managing social media. Suddenly everyone can be an expert. Vaccine hesitancy is a problem everywhere, and you might remember at the end of 2021, the vaccine hesitancy amongst the seniors, as we were coming out of all the social restrictions, resulted in many deaths. 1,700 deaths by the end of that period in Singapore. So people must remember what happened and act on that so that we don't fall for the same traps again.
You have a book with you here from CIDER, the Infectious Disease Emergencies, Preparedness and Responses. I suppose it will also address some of the issues or the gaps that you mentioned earlier: misinformation, vaccine hesitancy. It is almost like a handbook to deal with such situations. Tell us something interesting from it that you think our viewers should know about.
So it's not a book about COVID. It's a book about outbreaks and pandemics. And it's not a book about Singapore, although many of the authors are Singaporean. We've got about 115, I think, authors altogether, many of whom are world authorities. They come from WHO, Médecins Sans Frontières, Red Cross, all the major organisations across the world. So we've managed to pull on all those world experts to come up with what is 39 chapters. And it's unique. This type of book doesn't exist. You can get chapters or individual books on surveillance, for instance, or maybe on communications, or maybe on leadership. But this is quite specifically broad and covers, as I say, all those pillars of outbreak response in one place. And this will become the course book for our program.
Yeah, and speaking of this program, it will begin in July. There is an initial cohort of up to 80. What kind of students do you hope to attract on this program, and what will be the work that they'll be doing?
Yeah, thanks for the plug. Applications are open till the end of April. We're really looking for people with real-world experiences. So those early, maybe mid-career people that will become the future public health leaders. You remember, just being good at outbreak response spins off into many other things, because for a country to be ready or prepared for an outbreak, it has to be strong in surveillance and in communications and in relationships and in leadership and organisation. So this will, in preparing for an outbreak, you're actually making a great public health effort as well. So these are the type of people we're after. We're not going to be going didactic lecture. There'll be a few.
That'll be more interesting
than
that.
Exactly, because adults don't want to sit there and listen to how long can you last in a lecture? 8 hours a day? No. So there'll be a lot of discussion work, panel discussions, things like that.
Okay.
Because often the answer's not black and white.
You've had many leadership roles, Professor Fisher, in international outbreak missions and outbreak response trainings in African and Asian countries. What do you hope to see for Singapore and the rest of the world in global health preparedness?
I want to see it change, because I'm quite convinced at the moment that if COVID happened again, the response would be the same, and it could even be worse, because many people are even sceptical about what happened a couple of years ago.
Yeah.
So I think if we're empowering influential young people with this knowledge of how to prepare and respond to an outbreak, then that will filter hopefully across the community, and the community can be better prepared. Okay,
and what more can the community do to prepare themselves in such events like that?
Well, the most resilient community is like a healthy community, a well-informed community. So I think individuals can be becoming a bit more scientific literate. Understand that vaccines actually stop outbreaks, and a lot of people would have you think that they're evil. So we have to stop rhetoric like that, I think.
All right, Professor Fisher, appreciate your insights. Thank you so much for coming in to speak with us. That was Professor Dale Fisher, Director of Center for Infectious Disease Emergency Response.